I think we should. Okay, let's continue, guys. Let me share my screen. Okay, let's talk about null hypothesis. So, null hypothesis basically it says that there is no correlation between the treatment group, the treatment that you are studying, whether the intervention or the control, and the outcome which you are exploring. Like it's saying that basically, I'll give an example. Um, Metformin in patients with diabetes. So the null hypothesis says that there is no um, there is no correlation between the improvement in symptoms with in patients with diabetes and the use of metformin. That's the null hypothesis. So if the value of P is greater than 0.05, that means that the null hypothesis cannot be rejected and the results are statistically insignificant. There actually is no correlation between um, the intervention and the control and the population and the outcomes that you're studying. But in case the null hypothesis is less than 0.05, then you can reject it. Sorry, if the p-value is less than 0.05, you can reject the null hypothesis, and that means that your results are statistically significant. Is this point clear, guys?
Yes, ma'am. It's clear.
Okay. Nobody has any questions about this? All right. You guys can drop your questions in the chat and I'll get back to them. Meanwhile, we'll go further. Now, let's talk about heterogeneity without the slide for now. Akokla, I'm hoping that's how we pronounce your name. I'm really sorry if that's not how we pronounce it, but
Yes, ma'am. Yes, ma'am.
okay. So can you tell me that if we are taking 4 studies and they all have the same population, the same intervention, and the same control group, should they give the same results?
Uh,
Ideally.
can you please repeat again, ma'am?
I'm asking that if you have 4 studies which have the same population, the same intervention, and the same control group, should they have the same results? Ideally speaking.
Maybe yes.
Yes, they should.
Mhm.
They should have the same results. But we, when we are carrying out research studies or any interventional studies or original studies, we, you know, we introduce many errors and biases into the study, which affect the results. How is that possible? It's possible um, geographically. Like one study is being conducted in the North Pole and another study is conducted in India or Pakistan, or and one study is in Korea and one is in America. Now these are 4 very geographically diverse people, right? And we all know that People living in different geographical regions have different physiological characteristics, right? Now, if these people are so diverse, they are going to give you different results for the same population intervention and control. Why? Because they're different physiologically. Their bodies work differently. They're not going to react the same way to the same drug. And this is what introduces bias into your results. One study will say that, oh, this drug is not good. It does not have any positive effects. The second study will say this drug is really good. It is the best drug out there. The third study will say, oh, this drug, it's literally the same as the previous drugs. And the fourth study will say this drug is very harmful. Why does this happen? It happens because there are differences in the way these studies are conducted, in the number of patients, in the geographical location that these studies are carried out in. Let's take surgical procedures. Now, one study, there are three studies which are comparing two surgical procedures for aortic stenosis, for treatment of aortic stenosis. Now, one study, it employs very skilled surgeons, very experienced surgeons, and it is conducted in a country with very advanced technological interventions, and it has the best healthcare and everything. And the other study is conducted in a third world country with doctors who are not as skilled, who do not have any technology, any equipment. Will these two studies have the same results?
No.
No, definitely not. But ideally, they should have the same results. Why? Because they have the same population intervention and control. But they don't, because we live in a real world. Now, when we are doing a meta analysis, we take both of these studies with very different results and we put them together. We pool the data from both of them. Now, these studies should have similar results, but they don't. Why? Because obviously they have introduced some significant heterogeneity because they are based on different people. Another example I'll give, um, one study is including patients with very late stage cancer, and they are testing a new chemotherapy drug on the patients who have metastatized cancer. And another study is taking patients with stage 1 cancer and the same drug. Now, the drug is not going to have any significant effect on the patients in study 1. Why? Because most of them are past the point of treatment and recovery. And the first study, it will show that the drug has very positive effects in the patients. Why? Because those patients have stage 1 cancer. Now, what we do is that we put those studies together, both of them, both with very different results. And that also introduces heterogeneity into our findings because the population is essentially different of different cancer stages. Let's take another example, lung cancer. You are assessing a new drug for lung cancer, and you say that um, this drug is very good for improving overall survival in patients with lung cancer. Now, there's an issue that half of the patients in the study are smokers and half of them are non smokers. Obviously, the results are going to be different in both of those patients. Why? Because morphologically, physiologically, their lungs are different. One is a smoker, his lungs are damaged. He is not going to show the same results, the same efficacy of the drug as a non smoker. These are the things that, you know, exist in the real world, in real world studies. And how do we deal with this? We deal with this by assessing the heterogeneity and removing and reducing the heterogeneity. So let's come towards that. Heterogeneity means variation or differences in the results of the included studies. Why do these variations exist? They exist due to many reasons, which we discussed right now. So, are the studies showing similar results? If they are showing similar results, that means the heterogeneity will be low. And are the results quite different from each other? That means the heterogeneity will be very high. So, once again, we come to our forest plot. Look at these boxes. Are they closer to each other? They're closer to each other, right? They're almost all in the same line. So these results are closer to each other. Even look at the risk ratio 0.88, 0.79, 0.79, 0.89. Essentially almost equal. Almost. So that means that these studies are showing results which are similar. These studies are showing similar results. So what did we just study? We said that if the included studies are showing similar results, that means the heterogeneity is low. Look at the value of heterogeneity. It's 0. No heterogeneity exists. Now look at the other forest plot. See, they are far apart. Look at this one, it's over here, then here, then here. This one is over here. Like, look at the variation. This one is almost touching the line. See? And this one is all the way here. Look at the discrepancy in the results. Now, this could be due to different reasons. How do we find the reasons? You can easily find the reasons by reading the included studies and going into the details. And one small trick that you can do is that even if you don't want to read the full study, just go to the end and you will find the limitation section. And it will be mentioned in the limitation section that these were our limitations and this we could not address. These are the gray areas of our research study. You can find them out there. You can explore the causes of heterogeneity by reading the limitation section of the included studies. So see, there is so much discrepancy between the results of these individual studies. Like, look at this 59.34, 4.40. The difference 79.12, 7.37. Completely different. Look at the heterogeneity value, it's 99%. So that is what we mean. If the results are similar, almost equal, that means the heterogeneity will be low. If they are far apart, the results are different, then the value of heterogeneity will be very high. Okay. So 0 to 25% is considered low heterogeneity, and 25 to 50% is considered moderate heterogeneity, and 50 to 75% is substantial heterogeneity, and 75 to 100% is considered considerable heterogeneity or very high heterogeneity. And what do we do to reduce heterogeneity? We either perform sensitivity analysis, which is also called leave one out analysis, or we perform subgroup analysis. So we can discuss both of them right now. Okay, let me show it to you on RevMan. Don't look at the slide. Let me open a previous review, old one, and I'll show you guys there. So open the outcomes. Let me see which outcome had a higher value of heterogeneity. Okay, 0. See, 53%. Look at the placement. One is over here, over here, over here, over here. Different results. And the heterogeneity is higher than 50. If the value of heterogeneity is more than 50, then you carry out sensitivity analysis, which is also called leave one out analysis. So what do we do when we are carrying out the leave one out analysis? See, these are all the studies, 4 studies. Now remove the tick mark from here. Just tap it. And what happens when you tap it? This basically removes this study. See, the box for this study disappeared from the forest plot. Now it has appeared. Now it disappeared when we remove this. And how does this reduce heterogeneity? You remove one study, each study one by one, and you see that by removing which study does the heterogeneity considerably drop. Let's see. This drops it to 41%, from 53 to 41. Let's keep that in mind. Let's check the other one. This this increased the heterogeneity from 53 to 67. So let's just keep this one in. Let's check this one. 58. From 53 to 58, this increased the heterogeneity. Let us check the last one. 39. So removing the first one took it to 41 from 53, and this took it to 39. So we will keep this study out for the leave one out analysis. We are leaving this one study out. And what is the purpose of that? The purpose of it is to reduce the heterogeneity. The heterogeneity is now below 50. So it's not a considerable heterogeneity. You can work with this now. Is this point clear? How to carry out leave one out analysis?
Yes, ma'am.
Okay. So let's talk about something else. You guys remember random effects and fixed effects, right? At the starting. Do you guys remember?
Yes, ma'am.
Okay. So one thing you must remember is that when the heterogeneity is below 50, we keep the model as fixed effects. And when the heterogeneity is above 50, we keep it as random effects. Now, how does that happen? Initially, we choose random effects for all the outcomes. Okay? Initially, you choose random effects. But now that I've done the analysis and I see that this outcome has a very high heterogeneity, it's 88%. So, first of all, the first thing I'll do is that I'll keep this model as random effects. You can change it by just tapping here, change it to fixed effects just by clicking this random effects. So, it's 88%, the heterogeneity for this one. I'll keep this as random effects. Now, let's go to the other one. This one has 0% heterogeneity. So, wait, let me change it to random. Initially, we chose random bits, right? So this will say RE, right? RE. Now I'll tap it and it will change into fixed effects. This is just a simple thing. We don't need to, explore the reason behind it, and changing it and not changing it does not impact the results, but it's just something that we do. That if the heterogeneity is below 50, we change it to fixed effects. If it's above 50, we keep it as random effects. So that's it. I hope that point is clear. Let's come back towards the slides. Let's talk about subgroup analysis. So for subgroup analysis, it's also basically a measure of reducing heterogeneity. How? As I said, that when we are assessing the data is essentially may be divided into groups. Like, let's just say that one study is including both smokers and non-smokers. So obviously they're going to show different results. And how are you going to, sorry, one study is taking smokers and another study is taking non-smokers. So they're going to show different results. And if you pool the data together, you will have a higher heterogeneity in your results. So what do? We perform subgroup analysis. How do we do it? We add subgroup. Wait a second. Honestly forgot where it from. Introduce subgroup. Okay. So you perform subgroup analysis by introducing the subgroup. You add studies for this, whatever new subgroup you introduce. Like let's just say that your study, one study had patients who were above 60 years of age, one study had patients who were below 60 years of age. Even let's just say three studies had patients above 60 years of age, three studies had patients below 60 years of age. You initially made a simple forest plot and you found high heterogeneity. So you can either carry out leave one out analysis or you can perform subgroup analysis. Subgroup analysis is better because it tells you in detail which group of age, which group of patients showed significantly improved outcomes. So you enter the studies above, let's just say that the new subgroup is patients above 60 years of age, and you include the studies by clicking here. Those studies which had patients above 60 years of age, you input the data, then you go for the subgroup which has patients. Yes, I can. Subgroup analysis is carried out when we have to reduce heterogeneity because of the presence of different patient groups. Like, let's just say that some patients that we have total five studies, and they are all have the same general population, the same intervention, and the same control. But when you build the forest plot and you see the heterogeneity, it's very high. So you try to find the reason for it and you go to the individual studies. So what you see in the studies is that three of the studies had patients who were above 60 years of age, and two studies had patients who were below 60 years of age. Now we all know that some drugs don't really aren't really effective in patients who are older because our body systems are essentially all slowed down and not effective. So patients who are older will not show good results. But that is just the general, general thing that we say. So to stratify the patients into the two groups, the intervention group and the control group, what we do is that we perform subgroup analysis to reduce the heterogeneity and to find out which group is better in terms of patient outcomes. Is the drug showing better results in patients who are younger or patients who are older? Okay. So for this purpose, what you do is that you click on your outcome and add introduce subgroup. See. So from here you add the studies. Sorry. You add the studies. I'm sorry guys. I really can't figure this out right now. Something is wrong with this. Okay, how about we go over subgroup analysis, how to do subgroup analysis tomorrow? And today we just discuss why we do it and how, what are the implications of it. I hope that's okay with you guys. Okay, so let's give this a read. A subgroup analysis means dividing your data into meaningful groups to see if the effect of an intervention or exposure differs between them. In a meta analysis, it helps answer Is the treatment effect the same in all types of patients or settings, or does it differ by age, sex, disease severity, dose, study design, region, etc.? Suppose you do a meta-analysis of a new blood pressure drug, you notice high heterogeneity. So you do a subgroup analysis by age. Patients lesser than 60 years of age, patients, yes, lesser than 60 years of age, and patients greater than or equal to 60 years of age. So for patients lesser than 60 years of age, you notice that the risk ratio is 0.8. So that means that the risk is reduced by 20%. And for patients greater than and equal to 60 years of age, the risk reduction is 50%. So what does that say? That says that the drug seems more effective in older patients. How do we interpret this? Two groups are enough. Depends. It depends on the groups that are in your study. Like if your study is dividing the groups in three groups, like one is from patients 18 to 45, and then 45 to 70, and 70 to 90. Then you will do the same in your subgroup analysis. Groups can be more than two. Yes, and you can also divide it on the basis of study design. Okay, okay, Laiba. Give me 2 minutes. You can also divide it in on the basis of study design. Like let's just say your meta is including both RCTs and cohort studies. So you can perform the subgroup analysis on the basis of that as well. Like RCT is separate group and observational studies separate group. Obviously, they're gonna have different results because RCTs have better data because they are blinded and all of the data is collected in a better way. So you can perform it on the basis of that as well. Let's see. So this is a forest plot which has subgroup analysis. Like this was done on the basis of the dosage of the drug, like dose equal than greater than 25 milligram or equal to 25 mg, and this was 50 mg. Sorry, dose lesser than or I literally suck at reading greater than and lesser than signs, but yeah, okay, this was divided on the basis of dosage of the drug. See, 25 and 50. Now, these studies were those studies which had this dosage, and these studies were those which had this dosage. Now, obviously, look at the p-value for this one. This is also insignificant. This is also insignificant. So, this one has high heterogeneity still, and this one has zero heterogeneity. But look at the overall p-value as well, also insignificant. So you can say that the dosage of the drug is not statistically associated with this outcome with the outcome for which you constructed this forest plot. Did it make sense? It's a bit difficult to understand subgroup analysis, but the
Yes,
subgroup
ma'am.
analysis shows you, okay, it shows you the results of each group separately as well, and it also shows you the overall results. Like these are the results just for this subgroup, and these are the results for this subgroup, and overall results for these one. Okay, I'll show you guys how to make the plot in the next session, and we can also do manuscript writing.
Um, Ma'am, I just want to know one thing. Like previously, you told about one group out for the heterogeneity to be reduced. So, like, how can we differentiate? Like, either we go for a subgroup for this study, or either we have to go for just one group out for the
Okay,
heterogeneity to be. Yeah.
that's a good question. You can identify that on the basis of the studies that you've included. Like, let's just say you have 4 studies, and the patients are exactly the same, like same age, like almost the same age, and the smoking status is also the same, and there are no differences between the sex, like male and female ratio is almost equal, and there is still heterogeneity. So then you can carry out leave one out analysis. If there are no clear subgroups present between the studies, then go for the leave one out analysis or the sensitivity analysis. And if there are subgroups present, then you can do the subgroup analysis.
Okay, thank you. Thank
Yes,
you, ma'am.
no problem.
Also, I wanted to know, like, is there any formula, like, of course, the software can give the answer for the heterogeneity, but manually, is there any formula that we can find it out?
No, we don't have any formula for it.
Okay. Okay, thank you.
You're welcome. Any more questions?
No, I don't have questions now because I know you're also very much exhausted, but I
It's
want
okay.
to, yeah, I want to really thank you, like for your, like it was like very interesting. Plus, it was very much in depth. I mean, the session was quite insightful and many things, like small things you have incorporated everything so that we don't get confused and even you used to give a recap and make us understand. So I really appreciate that concern part. And yeah, looking forward for the next session tomorrow. Yeah, you
Glad
should
we
take rest
connected.
now.
I'm really glad that you did because I tried my best to, cover everything in a very basic way and to not miss out anything. Does anyone else have any questions? We could so that we can wrap it up. It's very late. I'll wait a minute for your questions. Was a good session. Thank you so much, Kalimullah. Thank you. You're welcome. So, live, you can end the session. I don't think there are any questions. But even if there are, you guys can send them in the WhatsApp. I'll answer them there.
Yes. Thank you, Fazia. It was a really great session, and I think they can text in the group if they have anything else to ask.
Yes. Okay.
So I'm ending the session. Thank you all.
Good night, everyone. Thank you so much.